BE35, me a BE47.
BE47. Okay.
Yeah.
All right. At least we are learning something.
I swear I'm off welcome.
Oh, so you know the person. Okay, that makes
Yeah, yeah,
sense.
yeah, yeah. My good friend.
All right. Okay. So when before we even move or allude into the topic for today, can you please tell us a little bit about yourself in a nutshell, 2 minutes? Who is Dr. Samuel Kwasi?
Okay. So, Samuel Koko say, um, you want poetry as in English?
English. Right now is all
Okay.
English through.
All right, definitely. So, I was born and raised in Ghana. Went to school, Adventist Preparatory School in Ghana. Then after that, I went to OFORI School. My number B47. I was in St. James. So right after high school, my ba has
Ah,
a
it's just the one next to St. Paul's where my
uh,
hall was.
yeah, St. Paul was so St. James, then we Koforia, then St. Paul is
Ah, so you
next.
guys really have St. Paul's. I was just making it up.
Yeah, yeah. We have St. John, St. Matthew, St. Mark, St. Luke, St. Paul, St. Peter, St. James, St. Andrew. And I think now they have other ones, but
Oh,
we are
okay.
on eight.
Okay.
But yeah, now we're St. James. 3-5 now was St. Paul. But anyways, so born and raised in Ghana, went to high school in Ghana. After high school, I came here. Initially, I thought I was visiting, but then I eventually went to, I wanted to go to school here. So I kind of went back and finished my last year in high school here in anticipating to enter college as in-state US in-state. So I did that. I got scholarship to go to University of Michigan where I did pre-medical education there. Then I went to med school in Michigan State. Then I did training in surgery, general surgery at Beaumont, Michigan. Then I did surgical critical care and trauma at University of Chicago. Then since then I'm here in Cincinnati, um, just I'm practicing here surgical critical care and trauma.
Okay.
Yeah,
All right. That is a very good background. But today's topic kind of hits home when we talk about it, because producer, remind me if I'm wrong. 2 years in a row, we had Dr. Boateng, who who is also an Owarian, and he was walking us through the sickle cell process, and that was
mhm,
something that was very personal to him because he always shared his story uh, about, and I think every platform he shares that about how he has a sister who is a sickle cell patient too, and that he loved to talk about it. I think
mhm.
he was a pharmacist. I forgot the state that he was in, and the mantle has been carried on by another Owarian to walk us through sickle cell. What is sickle cell disease? And
Great.
can you walk us through the process and everything that we need to know?
Do you mind if I share a screen?
Yes, go ahead and share your presentation.
Um, can you see my screen?
Well, we see, yes, now we see your PowerPoint right now. So,
Okay.
yeah,
You see now, okay.
there you
So,
go. Perfect.
sickle cell disease, basically, before I start, I do not have any disclosures. So why sickle cell disease? And why my interest in it? So I just want to start by pointing out that I am nowhere near the expert in the field. My field is surgery. And when PK, Dr. Asenso asked me to give a talk. Like I wanted to give a talk that a lot of us, especially Ghanaians, can relate to it. So I think a lot of us knows about sickle cell. Majority of us know at least somebody that is a trait or a career with sickle cell or have the sickle cell disease. Personally, growing up, I knew a bunch of people with sickle cell. I remember in third grade, one of my good friends, his name was Shafiq, he died from sickle cell. In JSS3, my other friend died of sickle cell. And in even Opoku School, one of my friends, I remember we were right, he was sickle cell disease. We were writing SSC. We finished our chemistry labs. I think it was a Friday. And I'm like, yo, so Pokemon we use numbers. So I'm not gonna say it's number, but BX. Um, we finished, it was around 2 p.m. Let's go eat Gary Silkins and let's go back and study. So we did that. And then I texted him, I called him, he was like, man, I'm sick, I cannot go. And at that time, I knew there was something about sickle cell.
A-class nice though.
I didn't know about the symptoms and everything. I'm like, come on, man, what do you mean by you are sick?
Eight,
SSC is coming, we gotta go.
692.
And long story short, he was admitted to the hospital on Friday. And Monday, he missed chemistry written exam, SSC. And then I think the following week, he passed away. So I kind of knew at least three people that passed away from sickle cell personally. And he was one of my good friends. So when I came to USA, um, in undergrad, University of Michigan, I was looking for a research opportunity, and I came across research team that was studying sickle cell. So I applied to it, and eventually I had an NIH grant to study sickle cell. And also, we eventually went to Ghana to do clinical research. We also did a bench research, and that's what developed my keen interest in sickle cell disease. And I'm sure a lot of people here know people that is related that have been affected with sickle cell. Now, this is gonna be an like informational talk, but I would like it to be a discussion. If you have any question or you have anything to put in it, please feel free to do that. We'll talk a little bit about the introduction of sickle cell, why the need of sickles to know about sickle cell, a brief history about sickle cell disease. Briefly, we'll talk about the genetics involved, the in mode of inheritance of sickle cell, symptoms and complications, what to look for if we in a person that have sickle cell disease, some of the treatment options, and then if we have time, we'll talk about genetic counseling. So, PK, answer to your question, what is sickle cell? It is an inherited blood disorder that affects the shape of the sickle cell. Also, when the shape is affected, it will also affect the function of the red blood cell. It's one of the most common genetic disorders that we have. But unfortunately, it is one of the least funded diseases because of the population it affects. Before we move on, what is red blood cells? So basically, in our body, in our blood, we have four components. We have red blood cells, we have white blood cells, we have platelets, and then we have plasma. They all come together to function as a blood and it's very vital to our survival. Brief detail, our red blood cells carries out the main job, it carries oxygen from the lungs to the tissues. And it's the main reason why we are alive. It has two components, alpha and beta. We're not going to go deep into it. So why do we have to know about sickle cell? So, like I said, it's one of the most common diseases, genetic diseases that we have worldwide, but it's not really funded well. If you look here, most recent census, about 500,000 kids worldwide are born with sickle cell. And if we take all the 8 billion people in the world, about 8 million of them are living with sickle cell disease. And in 2001, 2021 alone, about 370 thousand people, almost 400,000 people died of sickle cell. So it has only that year, it has a very high mortality rate. This is worldwide. And if it is this case where it has high high birth rates, why is it not funded much? We look into it. In sub-Saharan Africa, majority of the births that are born worldwide, about 80% of them is born in sub-Saharan Africa. So it's mostly the developing countries. It does not affect the developed country much. And even the developed countries that affect, um, they have a way of picking it up at an early age. So it doesn't affect them that much. And globally, the rate of increase of sickle cell disease births has increased to about 13% since 2000 because a lot of people don't have knowledge about it. A lot of people are careers and um, they don't have much knowledge about it. And as such, they end up having births, giving birth to kids with sickle cell disease. How about Ghana? So it is very common in Ghana, and that was part of the reason why I developed a keen interest in this. I knew a lot of people who were traits. I know a lot of people who are sickle cell diseased. Yearly, every year, there are about 15,000 to 18,000 kids that are born with sickle cell disease. Now, remember, this is very underreported because somebody that is born in a village that never goes to the hospital, if he has sickle cell and dies, it's not reported. This is in only areas um, in the cities that newborn screening are performed to detect these kind of diseases. So, like I said, it is very underreported. Now, if you look at the prevalence, that is the presence of the disease in children from 1 year old to 12 years old, the carrier, which is trait, this is not the full-blown disease, but the case with traits, it's about 16%. Now, if you take the Ghanaian population as a whole, if you pick every 4 people, 1 out of 4 people is a carrier of sickle cell, which is 25%. This is very high and it's at an alarming rate. And it is for this reason why we need to know more about this and be aware of it so we can know how to address this in the future. Before we go to detail, let's talk about a little bit history about sickle cell. Where is sickle cell from? How did it come in existence? It all boils down to malaria. Sickle cell disease originated as a genetic mutation in Africa many thousands of years ago, before the advent of vaccines and antibiotics. Malaria was one of the main killer diseases in the tropic regions. Now, a lot of people tell you that, sickle cell is disease from Africa, but that is not true. It's a disease in areas that malaria was endemic. That is areas that the female Anopheles mosquito, the vector for malaria, the parasite is Plasmodium malariae. The mosquitoes carries the malaria vector, the Plasmodium vector. So any region that these female Anopheles mosquitoes can survive there, malaria was endemic there. So we talk about the Mediterranean area, areas in Southeast Asia, South America. If you go to Europe, areas in like southern Italy, like Sicily, you go to Malta, areas in Europe, England, sickle cell was there. And then we do have sub-Saharan Africa, where majority of the people were dying from malaria. So people were dying a lot from malaria. And if you think about Darwin's theory of natural adaptation, um, for the human species to preserve itself and defend itself from malaria, it mutated one of its chromosomes, one of its genes, to become resistant to malaria. So the sickle cell itself, the hemoglobin S, if you have one component of it, it's a survival advantage. People that were carriers of sickle cell were not resistant to malaria, but when they get malaria, they are less likely to die from it. So that is how it was the body's defense mechanism against malaria. Unfortunately, um, if you have two coding or two of the hemoglobin S, then it becomes a disadvantage for you. People who are carriers were surviving more. They were less likely to die from malaria. But then if you have two of the hemoglobin S, then it becomes a disadvantage. You are more likely to die from malaria and other complications too. That is the origin of sickle cell. Now, without going much into details, I'll talk a little bit about the genetics of the disease. So the red blood cell, like I said earlier, it has two main components. the alpha block and the beta block. Now, every human being, we have a genomic print. We get our chromosomes 46. You get 23 from your mother and 23 from your father. Now, on chromosome number 11, that chromosome codes for the beta hemoglobin. Now, with the mutation, the body mutated glutamic acid to valine. And when the mutation happened, the name changed from hemoglobin A, which is the normal hemoglobin, to hemoglobin S. That is how the sickle cell disease, the sickle cell hemoglobin came into that. So that if you look into the genomic imprint, that is how it is. So hemoglobin A is normal hemoglobin. The mutated hemoglobin is hemoglobin S, which the defect was on chromosome number 6. So when you look at the algorithm, like I said, you get 23 from your mother, 23 from your father. So if you get both normal hemoglobins, you get A, hemoglobin A, you do not have the disease. If you get one disease hemoglobin from one of the parents and you get normal from the other, you get AS, which you are a carrier. And back in the day, before vaccines and um, antibiotics, you will be it will be an advantage, and you survive. You can live long with when you get infected with malaria. Then, if you get two imprints from the two defects from hemoglobin, sorry, two defects, which is the two sickle cell hemoglobins, you do have the disease. It's a recessive gene, and you'll be that's when we say you have the sickle cell disease. Other rare combinations is AC. Now, in Ghana, so based on the region you are from, the Middle East, so most of the sickle cell patients in Middle East, their variant is a thalassemia. Most people have AS, hemoglobin C, which is also it's a rare one, but very common in patients with sickle cell in Ghana. The mutation, instead of it happening on chromosome number 11, it happens on chromosome um, um, number 6. So that we get variant with hemoglobin C. So if you have um, normal hemoglobin and then variant on chromosome number 6 is AC, which is a carrier. You can get SC, which is also a sickle cell disease. You do get sickling of your red blood cells. And then we talked about the thalassemia. So, like I said, if you have to inherit two abnormal hemoglobin S's or hemoglobin C's to be considered as full-blown disease, sickle cell disease. If you inherit only one, then you have we call it the carrier. You do not have the disease, but you can pass it on to generation below you. Let's talk about mode of inheritance. So, what happens if one parent do not have the disease? It's not a carrier at all, but the other parent is a carrier. Now, based on the genetics, if you do that, you have 50% chance that one of your kid or your kid will become a carrier, and 50% chance that the other kid or one kid is gonna be have normal hemoglobin. So one parent who is normal hemoglobin and one trait can not have sickle cell disease kid, but they can have 50% chance of getting a carrier. But if both parents are traits, both parents have ASAS, there's a 25% chance that you have a kid with normal hemoglobin. You get 50% chance of getting a kid who is a carrier, and then 25% chance that you have a kid who has a full-blown disease, sickle cell disease. What happens if one parent is a trait and then the other parent has a full-blown disease? You get 50% chance of getting a carrier and 50% chance of having the full-blown disease. So then if you have a parent that does not have a disease, it's not a carrier, have a full normal hemoglobin, but then another parent that has sickle cell disease, what happens to their generation? Their kids, you get 100% of your 100% chance that your kid is gonna be a carrier. So we talked about the mode of inheritance and everything. So next, we're gonna talk about symptoms and what to look for if in case you live in a village, you are not in the health field, and you have a kid, you don't know your career status. What are the things to look for to suspect that this kid might have sickle cell or may not have sickle cell? As I'm going, if you have any questions, you can go ahead and ask.
No,
So,
Doctor Say,
before we talk about the signs and symptoms, it's important
Doctor Say,
we understand the pathophysiology, the disease process
Doctor Say,
of
can you hear
sickle
me?
cell disease. So, we need to know the difference between a normal red blood cell and abnormal red blood cell. Now, normal red blood cells, you look at in this picture, they are normally round. They are smooth on the edges. They are slippery. So when they are going through your blood vessels, they can flow through freely. When you do get sickle cell, when your blood is sickled, the shape of the sickle cell changes. Paul, do you want to ask a question?
Oh, I was just saying, go ahead and proceed. And once you're
Maybe
done,
not. Okay.
no, can you hear me?
Can you guys hear me?
Yeah, we can hear you, but can you hear me?
I'm assuming you can hear me.
Yes, I can hear you, but can
Wait,
you hear me?
somebody said not hearing anything. Can you guys hear me? Hello?
Yes, I can hear you.
Okay, good.
Can you hear me now?
Yeah, I do. I can hear you.
Okay, perfect. So what I'm saying is just proceed with the presentation. As soon as
Mhm.
you're done, then we're going to throw all the questions in there so that you have time to
Perfect.
answer all the questions, okay?
Okay, all right. So red blood cells are slippery and it goes through your blood vessels. It's made in that way so it can go through your blood vessels easily. With a abnormal sickle cell, with abnormal red blood cell, it's sickled. And as you can see in this picture, it interrupts the flow of the red blood cells into your vessels. Now, if in the bigger vessels like your aorta, your subclavians, and all your big vessels, that is not an issue. The problem comes when it gets to your tiny vessels. Your bones are one of the organs that have the tiniest blood vessels in your body. Your brain has tiny blood vessels too. And your end organs, your liver, your spleen, these are, and then your muscle, they all have tiny blood vessels. So when you have the sickling of the red blood cells, it leads to what we call vaso-occlusion. It occludes in your small red blood cells. Then with that, it slows your blood flow. That will eventually your body will send cytokines, which is like repair cells, kind of repairs damages in your cells to come in there and fix things. Now, with that, these cells, red blood cells, will become sticky. Your organs will lack, we're not gonna get the oxygen that they need. Eventually leads to tissue death. That is the pathophysiology of the disease. So then we proceed to some of the common signs and symptoms. We all know that sickle cell disease, they call sickle cell anemia, sickle cell anemia, sickle cell anemia. Their red blood cell, their red blood cells are low in general. So the reason is normal red blood cell in your body, the lifespan of it is 120 days. But if you have sickle cell, the sickling cells last for only 10 to 20 days. So the turnover is very high. Your body does not produce as many red blood cells as it dies. Average red blood cell life for a sickle cell patient is 15 days compared to 120 days. So at any point, there are less red blood cells in your body compared to the normal person. That is why you are normally anemic. Now, if you do not get blood flow to your joints, to your tissues, you start having tissue death. So you start having pain. So pain is a major one for these patients. Then generalized fatigue and weakness. Because you don't get oxygen enough to build, you get weak all the time. You are anemic. So you are weak all the time. Okay, every little thing you do, you get tired. Thrombogenic, you are prone to getting blood clots because if you go back to this picture here, when the flow is interrupted, the blood doesn't go much And then, not to go into much detail, we have something we call Faircow's triad. That is what things that happens for you to get blood clot. And a slowdown of your blood flow can lead to it. Damage to your blood vessels with sickling tissues here can damage your blood tissues. That is one of them. So that contributes to blood clots. So thrombogenic, you get blood clots. Delayed growth. If you do not get oxygen to your bodies, you do not, your cell doesn't grow. You die, your cells die quick. And as such, you get growth retardation. So most sick people with sickle cell, they are usually skinny. They are not, they don't get their full growth potential. Now, if you have your eyes is one of the organs that have tiny vessels in it. If you get little clots in there, you get decreased you get vision problems. So these are all the common signs that you can see in patients with sickle cell. Now, these are signs, but then we do have complications. What are the things that can happen? What are the complications that can happen to patients with red blood cell that can be detrimental to their life, that can cause death? Now, infections. This is the leading cause of death among sickle cell patients in developing countries. So I did one of my NIH researches was to look into um, patients with sickle cell in Ghana. Now, in the early 2000s, the mortality rate for sickle cell the first 5 years was about 35 to 40%. Whereas if you compare to the developing countries in developed countries in USA was very low. What was the reason why these cases were dying at an alarming rate compared to um, the developed countries? Or even in Ghana, case with sickle cell in the cities were living longer, the mortality rate was low compared to kids in the villages. They were dying all the time. And the reason is most of the parents in the villages, they did not know um, the disease status. They didn't have much knowledge about the sickle cell. So at a younger age, the first 5 years of life is very salient. Their fetal hemoglobin is developing into adult hemoglobin. Their immune system is low. So these patients were prone to infections. Their spleen was not working much, and your spleen is one of the organs that protect us from bacteria that has encapsulated bacteria. That's what we call them. That is strep pneumonia, salmonella, Neisseria meningitis, all these antibacterias. If you do not know it, they get repetitive infections, and the infections were the ones that were killing kids in the first 5 years of life. Now, there's this virus we call parvovirus B19 that in US you can get it, they also call it F.A.C.S disease. It's a very common disease here that happens in the flu season and stuff like that. Case with sickle cell disease, when they get this virus, it leads to aplastic crisis, or it wipes out their red blood cells and they can just drop dead. So that was one of the main things that were killing kids within the first 5 years of life. The treatment for this complication, you got to vaccinate these patients against these encapsulated bacteria, which is strep pneumonia, Haemophilus influenza B, Neisseria meningitis or meningococcal, hepatitis B, influenza. Those were the ones that you get vaccines against. And then, because they are so prone to infections, we used to give them prophylactic antibiotics, penicillin, every day for the first 5 years of their life, and that can prolong their life. Infection, that's the first complication that affects kids at a young age. The next complication is stroke. Now, remember, I said your brain is one of the vessels that organs that have tiny vessels going in. In your neck, there are two main vessels that feeds oxygen to your brain, your internal carotid arteries. They are big, so that is not an issue. Once they get into your brain, we have what we call the circle of fluids, and it comes in and then it connects together and feeds, it branches to tiny vessels and feeds your brain. Now, since they are tiny, if you do have severe sickle cell and the cells are sickled, you get decreased blood flow to your brain, the terminal ends of your vessels. That can lead to stroke. So in patients with severe sickle cell, they can show weakness, difficulty speaking, seizures, signs of stroke. And it's all, like I said, due to decrease in blood flow to your brain. Now, how do we prevent this and how do we know this? Because of course, it's better to pick it up before these kids have stroke. So if you have patients that are high risk sickle, they have severe cases, we do what we call transcranial Dopplers. So it's like ultrasound. You put it on their skull, and then you look at their vessels and you measure the speed of blood flow in their vessels. Now, if the speed of blood flow is decreased, then you see these kids are prone to having stroke. Instead of waiting for them to get a stroke before you treat them, you can prophylactically give them serial blood transfusions. And serial blood transfusions, like you get rid of their sickle cell blood, and then give them regular blood cells, so it will improve blood flow to their brain. And that is how you tend to decrease strokes in these patients. Now, if you have a baby and you see that they're having generalized weakness in their legs, difficulty speak, sudden speech difficulties, loss of consciousness, it's important that you, especially if you do know that they have sickle cell, it can be a medical emergency. You rush them to the hospital so they can give them blood transfusions and prevent them from getting stroke. And even if they have these symptoms, transfusing them can decrease the severity of the stroke. Then we go to pain crisis. We also call it sickle crisis. Now, if you do know somebody that have sickle cell, probably you know they've had these symptoms before. It is the most common presentation that patients come to the hospital with. Now, they get severe pain crisis, mostly in their joints, in their bones, in their chest, in their belly. And it's caused by blocking of blood in the vessels. Like I said, especially your bones is the tiniest, it has the tiniest blood vessels. So like I said, the pathophysiology of the sickling cells cannot go into the bone, the tiny vessels. So thereby blood doesn't flow through there, you get ischemia and it causes pain. Usually lasts for hours, sometimes to days. And seasonal changes. If you're in Ghana, like going from rainy season to dry season, this can happen a lot. When it moves from cold to warm, it can happen. Warm to cold, it can happen. Um, Diseases like if you get infection, you can get pain episodes in that. Now, a lot of patients in USA, they they see this they are seen as drug seekers. They come to the ER a lot and they require a lot of pain medication, and people look down on them thinking these guys are coming in for just pain. Because if you don't have the knowledge about sickle cell, you would think these patients are drug seekers. And because of the pain, and usually they get narcotics and stuff, some of these patients are sensitive to these narcotic medications, that it's important to give them the appropriate analgesia to help them get through their pain crisis. In Ghana, I remember like in school, like you get these patients that will be missing school, especially if you're in the elementary school like that. And if you live in the village, they wake up early in the morning, they're in pain because it's cold in the morning. And then sometimes if your parents do not know that you have sickle cell, they beat the kids to get up and go to school because you are lazy. They get swollen in their joints and stuff, and they struggle through this. And that leads to their mortality. And I don't blame the parents or anything, but sometimes we do not have much knowledge about this disease. And patients end up struggling from the sickle cell disease instead of us helping them. Next one is acute chest syndrome. Now, this is the most life-threatening um, complication in sickle cell disease. Now, also in developed countries. Now, this is a medical emergency. Okay, it's a leading cause of death in sickle cell patients in developed countries. Now, they get sudden onset of chest pain, coughs, fever, and breathing problems. The pathophysiology behind this is you get blood clots or you get decrease blood flow in your lungs, thereby causing areas of necrosis or ischemia in your lungs. And you can just, you just have to, when you see this, you have to go to the hospital and have them treat you as soon as possible. It can be triggered by infection, being viral or bacterial. Um, excuse me, if you get sickling lung crisis, you can get fat embolism. Like if you get necrosis in your bones, you can throw an embolism to your lungs. That can lead to acute chest syndrome. Next, treatment is they go to the hospital, you give them hyperbaric oxygen or oxygen therapy. You gotta make sure they keep up with the oxygen. You give them broad spectrum antibiotics as infection can cause that. You give them blood transfusion. You transfuse them as much as you can to replace the sickling cells. And lastly, you control their pain because exacerbation of their pain can lead to that. Next are some of the things that can happen in males. We call this priapism. This is painful, prolonged erections in males. So it's usually repeated episodes. Yeah, it has nothing to do with sex. Um, this is like it occurs when blood flow to your penis that is sick, the cells are sickling, so it can cause lack of flow in your penis, and that can end up causing painful erections. So something is happening on the screen. Okay. Now, like I said, it occurs about 30 to 45% in males with sickle cell disease at some point in their life. Now, the treatment is hydration. When this happens, when it lasts more than 4 hours, it becomes an emergency. Okay, so you have to seek hospital care. Hydrate the patient, you give them oxygen, pain control. When it lasts more than 4 hours, to aspirate that sickling blood from your penis, to stick a needle in it, draw the blood out, and then replace your red blood cell, and that can help with that. Sometimes they can give nitric oxide, which is like a medication that dilates your vessels, that can open it up and have blood flow, improve blood flow to your penis, and that can help with it too. Next is dactylitis, and that usually the case their hands look like this. Usually happens in the first 6 months to 2 years in life. You get swelling of their joints. Usually it's present in patients with severe symptoms. It's also called hand and foot syndrome. Um, the hands get swollen because of lack of blood flow in it. They get reperfusion injury, and treatment is usually supportive care, um, good hydration, and medication that we talk about it called hydroxyurea. Other complications that I'm not gonna go deep into because this is more overview. If I go super detailed, it might um, take us all day. But gallstones, you can get gallstones. You get jaundice because of the breakdown of your red blood cell. The turnover is high, and jaundice, the yellow in jaundice is usually from the bilirubin, breakdown of the bilirubin in your red blood cells. So you can be jaundice. Sometimes, because due to decreased blood flow to your lower extremities, you can get leg ulcers. Majority of the case, by the time you are adult, your spleen will be damaged. You get shrink down. Usually, that's a sickle cell disease patients. Now, if you are thalassemic, if you have thalassemia disease, your spleen can be very big. Usually we tell patients not to do contact sports because if somebody hits you, it's gonna have a manner, your spleen can rupture. So treatment strategies mainly is aimed at avoiding crisis, relieving symptoms, and preventing complications. So usually patients less than 2 years old, it's advised that they do frequent checkups with their physician, usually multiple times a year, because they need to be kept, because that's the time that your immune system is the lowest, and you have to keep a close eye on you now. The less episodes you get, the more likely that you're gonna live longer. Now, patients older than 2 years old to adults, it's advisable that you see your physicians yearly and get yearly checkups. Even your first 5 years of life, like I talked about, prophylactic antibiotics, usually penicillin, is important to avoid life-threatening infections. Also, vaccinations against encapsulated bacteria, which I can go into details like strep pneumonia, Haemophilus influenza, Neisseria meningitis, influenza, Salmonella, all these things. Get vaccinations against them, and that can help you. Frequent blood transfusions is also important, especially if you get pain crisis or if you get symptoms of strokes and stuff, that can also help you. Now, there's a medication that usually helps patients. We call it hydroxyurea. Now, this was an accidental medication. Hydroxyurea is usually used to treat cancer, but they realized that when you give cancer patients hydroxyurea, it stimulates the production of fetal hemoglobin. Let me spend a little bit time here. Now, when you are born, about 90% of your blood is fetal hemoglobin. And as you grow up, after 6 years, 6 months of life, your fetal hemoglobin will convert to adult hemoglobin. And as you grow, so 90% fetal hemoglobin, 10% adult. And after 6 months, as you grow, fetal hemoglobin comes down, adult goes up. All right, around 5 years old, it's reversed, 90% adult, 10% fetal hemoglobin. The reason why you want to stimulate fetal hemoglobin is it has high affinity for oxygen. So it doesn't let oxygen go much. So it does not sickle easily. So it takes a lot for fetal hemoglobin to sickle. And as we talk about all the signs and symptoms here, the more sickling your cells are, the more complications you get. So if you get red blood cell that doesn't sickle easily, it's better for you. So if you give patients hydroxyurea, it stimulates the production of fetal hemoglobin. And if you have more fetal hemoglobin in your body, you get less complications. And that's the function for the hydroxyurea. Now, it is important to know that sickle cell in general, you cannot cure it. It's a genetic disease. But there is bone marrow transplant where you can alter the stem cells in your body and just to trigger your body to produce um, normal hemoglobin. It's a stem cell bone marrow transplant. You have to get a good match to do a bone marrow transplant. And if you do that, when I was in University of Michigan in my research, I saw 3 kids that were treated with bone marrow transplant. That technically they were cured, but I did not really follow them long enough, so I don't know what happened to them. Now, it's very high risk procedure. It has high mortality risk. It has high complications. You can get rejection of the bone marrow. You have to find a match first. And you find a match, you can get rejection of the bone marrow transplant. Sometimes you need to get chemotherapy to wipe out your bone marrow, so you don't get rejection. You can get infection, and you can lead to death. So usually it's reserved for patients with severe symptoms that without it, their mortality is already high. And if you are older than 16 years old, the chance of you reject bone marrow transplant is very high. So we don't really do bone marrow transplant for adult patients. Other therapies is gene therapy and also DNA modulation. So gene therapy, if you look at, as I discussed to you about hydroxyurea, it stimulates the production of fetal hemoglobin. So that's one of the research that I did. So if you can give hydroxyurea, to patients to stimulate their fetal hemoglobin, then what can we do to the body? My research study was, what can I do to patients or patients with sickle cell disease? Can I manipulate their gene so they can continue to produce fetal hemoglobin and stop producing adult hemoglobin. So that was the question, and what can I do that? So we found a transgene. We call it a transgene TR2, TR4. It's an orphan gene that can help. So modulate, without going too much deep, modulate your genomic print, produce a lot of fetal hemoglobin. So when that happens, it's going to decrease your complications significantly. So we used lab mice initially. We had the mice, and then we genetically mutated the mice. We kind of gave them sickle cell. We knocked out their mouse alpha, sorry, um, hemoglobin, chromosome 11. We altered it from glutamic acid to valine, gave them sickle cell, and then we transduced their TR2, TR4, and then so these mice with sickle cell, but did not have any of the complications. So then we realized, what can we do? How can we translate it to human beings? So you cannot just go and just do it on try it on human beings. So in the lab, we knocked out the mouse alpha and gave a human alpha. So they were lab mice with human blood in them, and then we infected them with sickle cell, and then we treated them. Now, if I've noted, mortality rate for sickle cell patients who get pregnant at some point was 20%, right, before they give birth. So we treated these mice, and like with mice, whenever the pregnant mice sickle cell, they all died. But when we transduced the TR2, TR4, they all survived. And that increased their lifespan. Lifespan for mice is 6 months, but this sickle cell was living 2 months, but then they were able to live 6 months. So when you translate it to human life, these mice were living, they have a normal lifespan. So when you compare to human beings, if you transduce your TR2, TR4, you can end up having a normal life without any complication. You can get pregnant without any complication and have a normal lifespan. That was my research. We got published, and I left Michigan, so I don't know how it ended again, but that was about it. Now we also have like some DNA modulations that you can have telomerases come in and cut out your chromosome 11, take it out and put in a normal hemoglobin, a normal genomic printing that does not code for hemoglobin S. That can also solve it. Now, these are all experimental works that has not translated into normal human applications. Because sickle cell is not funded a lot, it's hard for these things to move through because of the population that it affects majority of them. Now, so prevention, what do we do from here? Since we know more about the sickle cell now, what do we get from this? It is important to know your hemoglobin status. Like I said, 1 in every 4 Ghanaian is a trait for sickle cell. If you do not know your sickle cell hemoglobin status, you should know it. Sometimes, in some communities, even Ghanaian communities, it is advisable that when you are getting married, you do genetic counseling. Make sure you know your significant other's hemoglobin status. If both of you are traits, if you have AS, both of you are traits, you do have 25% chance of having a kid with sickle cell disease. If you have no sickle cell disease and other person is sickle cell, you have 100% chance of having babies with carriers. Know your kid's hemoglobin status, and seek more information for your family and friends that have sickle cell disease, and then support friends and family with sickle cell disease too. And with that, I think that's all I have. If you have questions, you can go for it.
All right. Thank you very much for the awesome presentation. Um, we're gonna start rolling off with the questions. We have about 45 questions right now for
Oh
you.
my God.
the The goal is to complete all this by 7:30 p.m. So, um, we will try our best as much as possible to get that taken care of. All right. So, this is from Fadi. Fadi says, "Hi. I would like to know the main cause of death when it comes to sickle cell. Is it the crisis itself or the other factors that lead to any kind of organ failure? I have sickle cell and I'll be 53 in November. When I get a crisis, I only spend a few hours at the ER. Not to forget, I grew up being told that SS patients don't normally live beyond the age of 30. What am I what I'm experiencing now is shortness of breath on a few occasions. This 30-year thing, was it a realistic um information that was out there, was just a myth? Because I heard this when I was younger too. That a lot of people used to say that, oh, when you're sickle cell, you can't, when you don't die before the age of 30, you're gonna live long to the full fledge of your lifespan.
So if you think about it, like I said, the pathophysiology of the disease, and it was said that if you have sickle cell, it's either you die the first 6 months, 5 years before you are 18
Mhm.
or 30, right? And it's all was markers of when the complication peaks. So first 5 years is infection, right? So if infection doesn't kill you, chances are it's probably not gonna kill you, right? Then it comes to risk for strokes as a young person, right? Sorry, risk for acute chest syndrome because you are very active. If low flow to your lungs, it can cause acute pain syndrome. Then at older age, risk for stroke. Now, that is when there were not much knowledge about sickle cell, right? You didn't get blood transfusions. You didn't, if you were a kid, you didn't know about it, and you didn't get prophylactic for penicillin, right? Now there's a lot of knowledge about sickle cell. In USA, the lifespan is if you keep up with the treatments and everything, it's not much different from the average person, right? But the complications are gonna be higher. You might need more than average blood transfusions. Back in the day, infections related to transfusions was also high. That can affect them. Back in the day, when you have pain crisis, they just beat you to go to work, right? They don't really treat it. That is what was affecting their mortality rate. Regarding your question, you are 50. I mean, as long as you take good care of yourself, you do your regular checks, and then know more about the knowledge, know more about the signs and symptoms, and you seek frequent checkups, you should be fine.
So is it more or less the crisis that kills you or other factors that kills you when it comes to
Um,
success?
Usually for it's age dependent, right? Right now, if you are 50, other factors can get you, but the crisis, if you realize it soon enough and you seek medical treatment, you get pain control and you get appropriate transfusion, you should be fine. Sometimes you get hydroxyurea to produce more fetal hemoglobin, you should be fine. Now, if you have more crisis and you don't seek help, the crisis will kill you. Now, if you seek
Okay.
help, then usually there'll be other complications.
All right. So these are just contributions that people added. So Aulion iPhone B said, "Do you take any medications?" Fadi come back to say it's folic acid. I don't take it every day. Then Aulion says, "Have you tried zinc supplements?" He says, "No, was never recommended to me." Then iPhone goes, "Not everyone get into serious crisis. Some people have never had crisis at all." And Fadi says, "I get crisis twice a year from stress. So that means stress can also take a toll on your body." Do you take like that is the one that you
Hydroxyurea.
hydrosera? Is that what it is?
Hydroxyurea, yeah.
Oh, hydroxyura. Okay. And he says, no, I asked my primary about it and I am waiting. I'm pretty sure that's what he was trying to say. I am waiting on my next appointment to discuss it with him. I have heard about it, but by talking about the spleen, I have been told I have an enlarged spleen. So that is kind of like, buttress the fact of what you were saying, that some people are advised not to get into sports because of the enlarged spleen because it can get punctured.
Mm, yeah.
And Leon goes to say, "Oh, okay, it is good. That's what I give my daughter." So, take dandelions, licorice. Is it licorice or licorice?
Licorice.
Licorice.
Is it? I don't know, spell it. I don't know.
Licorice.
Licorice, yeah.
Okay, and burdock roots. I've heard a lot about this burdock root tea. That people talk about even with cancer patients and stuff. It helps with the spleen and vitamin D too. Father says, I hope he puts me on that because if this is if this, I'm even scared of moving totally to Ghana. But I had a vascular when you're in the medical school, no, the crosses and caused me to have a total hip replacement. Otherwise,
Avascular necrosis.
so um there are contributions in there, but also it gets a little bit more conversation between the two people. So I'm gonna move on to the next question.
So
Sharon's.
I want to point to something, PK. Somebody said folic acid, right? It is true. So folic acid is a component that your body used to produce hemoglobin, right? Folic acid and iron. So since they are anemic, they say take folic acid. It will help increase your production of red blood cells.
Yes. Sharon's iPhone says, "Could you explain SF, please?"
SF, yes. So SF usually, right? I think you get that in newborn screen, right? So F is, if I'm hearing what he's saying, F is a fetal hemoglobin, right?
Mm-hmm.
Fetal hemoglobin. S is sickle cell hemoglobin, sickle hemoglobin S. So SF eventually, when you grow, it will become AS or SA because the fetal hemoglobin will switch to so hemoglobin F will switch to hemoglobin A, which is adult normal hemoglobin. So in USA, you do you do newborn screening. So sometimes if your kid is a trait, they'll send you an email that or a letter that is SF or unknown S and unknown as SU because the other one is unknown. They gotta wait for you to know what if it is a hemoglobin A or C, right? So it will say unknown, but usually when you do SF, it's mostly when you're a kid and you have a lot of fetal hemoglobin in there. So hemoglobin S and hemoglobin F.
All right. iPhone says the SF is complicated. Fadi says never heard of SF. It's really common in Ghana. Keep going. iPhone says if it's adult, then it's more likely hereditary persistence of fetal hemoglobin. Then says SF for a baby, please. Oh, so SFs
SF
are
is for babies. Yeah.
okay. It's
So
been
hemoglobin F is a fetal hemoglobin. Hemoglobin A is adult normal hemoglobin.
mhm.
Hemoglobin C is a variant, and hemoglobin S is sickle hemoglobin. So if you have SF, it's sickle hemoglobin and a fetal hemoglobin. When the kid grows up, it's gonna be SA or AS.
Okay. Is being a carrier a health risk? This is from Simeon.
So, good question. Is being a carrier a health risk? In general, not. Now, because it's a survival advantage. There was one case that my attendant, my research PI went to do an expert witness in Florida. There was a football player that dropped dead during football case. He was a sickle cell trait, AS. Now, if you get severely dehydrated, you can get effects of it. Now it's very rare. That's why he had to get expert witness to it. Now, so that's the only one that I know. There was a football player that dropped dead during football. Florida was hot, very humid, and it was not hydrating. Now, if overall AS it's not complicated. You might sometimes if you do a CBC, you do blood test, you might be slightly anemic. I'll suggest that you keep more you hydrate a lot when you're doing any extreme sports, or if you are extremely dehydrated, avoid being extremely dehydrated and you should be fine.
Okay. Fadi comes back to says I was told I have SS with fetal hemoglobin by my hematologist here in Atlanta. Is that normal to have that combination?
Like I said, F is a fetal hemoglobin, right?
No, his
So
was SS.
SS,
Yes, he said he was told that he has SS.
yes. So that's
Yes.
sickle cell disease.
So with the fetal hemoglobin,
Mhm.
So with that combination, he's asking if that's a normal combination.
So you have sickle cell SS with a variant of fetal hemoglobin. I'm telling you, the fetal hemoglobin is very little. Remember when I said that when you are growing up after 5 years, you get 10% of adult hemoglobin and 10% of fetal hemoglobin. Everybody at any point you have a small percentage of fetal hemoglobin. That's probably what it detected, but majority of it, 90% of it is SS.
Okay. For the baby, you have to wait after 6 months to see if the F is persistent. If not, it's likely SS. And this is from iPhone.
Yes.
And Fatty says confusing. I hear you both. I think that's the communication that he was having in the background.
Okay.
This is contribution that yes, you can hear it. Okay, Z and M says is AC too sickly? Please, can you throw more light on AC?
Okay. So, like I said earlier when I was talking, we have hemoglobin S, hemoglobin A. Those are the very common one. We have a rare ones, which is hemoglobin C. Now, hemoglobin S, the mutation is on your chromosome number 11. Hemoglobin C, the mutation is on your chromosome number 6. Symptoms are fairly similar. So if you are AC, you are a carrier. If you are CC or SC, you are full-blown disease. So AC, technically, there's no difference between AC and AS, which both are carriers of the disease. Just the mutation is on a different chromosome.
Okay. Akosia came to ask about stem cell transplant being a solution, and I think you already responded to that. So
Bone
we're gonna
marrow
proceed.
transplant, yes.
Yes, we're gonna
It
proceed to
is, it
that.
is, but it's very risky, and it's reserved for very severe
Like you
patients.
said, it's safer when you're below the age of 16, and after the age of
Yes.
16, it gets a the mortality rate is high.
No, it's not safer. It's reserved for those patients because the risk, though it's high, it's less than older than 16 years old, but it's still high.
Okay.
You get what I'm saying?
Yes. It's weird how you're looking at me from the bottom of your screen, and we are also looking at you from this side. But I figured that's where your screen is at. Well, that's where you're looking at from.
Yeah, I'll
Okay.
move it up here.
All right. So Fatty says it really sucks. I have three siblings, and I was the only one that got the disease. And as a result, I can't even have children. I have azoospermia. I don't
Azoospermia.
azoospermia, and I don't know if that's because of this. Okay, Fadi, you're getting a little personal. Um, I'm not sure it's because of the disease, and iPhone just came to say that hey, I'm not sure it's because of the disease.
It
Um,
it it could be. So azoospermia is like low sperm count and stuff, right? And if it's
no,
all
no, no. He was saying that he thinks the result of that is because of the sickle cell.
I don't know about that.
Exactly, and that is why iPhone keeps to say I'm not sure
Yeah.
the azoospermia is because of the sickle cell. All right. So Denis Abuku says, when can we? Oh, Dennis, you're talking about the app itself. That will be after this session. We'll do it a Q&A session. But again, 18th is the date that they gave us right now. If anything happens sooner than that, you will know. And we will all get a notification basically at the same time from the app as well. Ferdi says, I want to know if azoospermia is one of the complications of sickle cell.
Not that I know of, but like I said, I'm not an expert in that field. I just did a lot of research in it, but not that I do know of.
So that'd be a good way to contact your doctor about it, and your doctor should probably let you know more details. Nana Benito says greetings to everyone. Nana Benito, greetings back to you all the way from Ghana. Ifo says if you are and your significant other have AS and you are in the US, you can request for Unity screen with reflex SG NIPT when you are pregnant to see if your baby will also have sickle cells. It can be done around 8 weeks of the pregnancy. I think this is a contribution. This message came to me private, so I won't mention the person's name because I wasn't sure if it was sent to me private by mistake or the main two. So I won't mention the person's name. The question says, my partner and I are both carriers, ASAS. What are the options to prevent having kids that carry SCD?
So if you look at this screen here, if you are both carriers, you have 25% chance that you might have kid with sickle cell. Like what the comment that the person before you said, sometimes if that's why it's important to know your status. So even if you don't want to have a baby, you do genetic counseling and then you can do pre-conception counseling. You get you can do IVF first of all, in vitro fertilization, then you figure out the case that is not sickle cell, then you can get implanted and then you have that baby. Or even if you other option is if you have the baby within the first 8 weeks, they can do chorionic check. That can then test that they will draw blood from amniotic fluid
Hmm.
and see if the kid is SS, you can terminate the kid and have another one. But the better option is you do pre-conceiving counseling and you can do in vitro fertilization. You get a case, and then the one that is not sickle cell, they can reimplant and then
Okay.
go from there.
Ifo says I'm SC, but I have no crisis for over 10 year now. I'm not on any medication. Do you have if you I think what he's trying to say, he or she's trying to say the SC, but they have never had any crisis for over 10 years now. They're not on any medication. Is there any future risk? They used to have crisis when they were children, when they were a child.
So, like I said, not 100% of sickle cell patients get crisis. We have mild sickle cell patients, we have severe sickle cell patients. It's a spectrum. Maybe you got lucky and you are not among the severe ones, but it doesn't mean that you're not gonna get anything. It's important to know more about the disease and know the signs and symptoms and address if in case you happen to have it in future. It is
Okay.
possible that you're not gonna ever have it again, but it is possible you will have it tomorrow. So know the signs and symptoms.
Okay. Because here, Apatu says, can AVN be reversed?
What, avascular necrosis? Wait, AV what?
N.
Avascular necrosis. Now, so avascular necrosis is, especially it normally happens in your pelvic bone, which is your femur. So usually because of the decreased blood flow to your bone, right? You get necrosis of your hip bone. So your hip bone is basically necrosed. Usually it's in the middle of it. It's kind of soft and hollow. So it's easily to break. So normally these patients, they get hip replacement. I don't
Oh,
think I've seen one that has been reversed before because the tissue is already necrosed. The tissue is already dead and now it's necrosed. So you cannot really revive a dead tissue.
okay. Sharon says, I have a newborn baby. Oh, I take it back. If a newborn baby has an SF, and if the F goes down, is it more likely to change to SS or AS?
So if you have SF, the F means it's a normal fetal hemoglobin. So that if the F goes down, it means the A is coming up. And that's how it's supposed to be, right?
Hmm.
So I think it's just wait and then recheck it after 5 years or then see where it is. But
As for says,
most likely it's an A.
okay. As for says SC trait, I get crisis occasion. I'm pretty sure he or she is trying to say trait.
SC is not a trait, it's a disease.
It's a disease.
You
Okay.
have you have hemoglobin S and hemoglobin C. AC is a trait. AS is a trait. SC is two abnormal hemoglobins. It is not a trait.
Okay. Aliens iPhone says, can you talk about food and nutrition with sickle cells?
Yeah, so have to eat healthy. You gotta eat foods that can help you produce increase your production of red blood cells, right? You have to get a lot of eat with like food that is high in antioxidants, right? So those are all gonna help you out. You give vitamin D, multivitamins that will help produce hemoglobins because the diet aspect of it is for you to be less anemic, right? That's what people are saying, some roots and stuff like that. I don't really know much about. roots that people were saying, but dandelion and whatever that can help you produce more red blood cells will make you less anemic, and that will help. But with the diet that is gonna fix your sickling cells, usually the best thing that can help is you keep adequate hydration. More hydration decreases the rate of your sickling cells.
Okay. I even say some traits on electrophoresis has more S than A, so that person can get into crisis. I think that was a
So
statement, not a question.
electrophoresis, that is how you do check sickle cell. Like you do gel electrophoresis, and then it determines how severe it is. It's not like it's more S than A. It's more like a mosaicism. It's kind not the term of it. It's if even though it's equal, right? But it tend to lean towards the left, the S instead of the right. So instead of the A. But we call it mosaicism. That's all like expression of your gene. That's more into detail to it, but you don't have more S hemoglobins than A. Because remember, it is at the end of it is 23 chromosome, but the expression kind of shift to the other side. That's usually what makes it more severe and less severe.
Okay. The next here says, is it true that women are prone to anemia more, or it is a myth? Also, how can someone in the States find out if they have sickle cells? And lastly, can your blood type contribute to sickle cells?
Number one, starting from the latter part of it, your blood cell type does not determine your sickle cell because the production, the route is different. What was the second question?
The second question, how can they can find out from their primary care doctor?
So in USA, there are different ways of checking it. First, if you go to a physician, they will initially do a complete blood count, which is CBC. Based on if you're anemic, they can proceed and do gel electrophoresis, right? But usually they do CBC first, and if it is like strict normal, it's no anemia, chances are you don't have it. But then you can, if you are it's abnormal and there's a risk, then they proceed with gel electrophoresis.
And Bella says, what can people with AS do to help combat I'm pretty sure you want to say anemia or iron issues, especially women.
Take iron pills, eat healthy,
Supplements.
and then hydration.
Michael Abuja says, is there any medication for a couple who are both AS to take prevent giving birth to a child with SS?
No, not that I know of.
I don't know who iPhone is, but I love this person, man. I forget quick responses for all the questions, man. Belinda Sariteta says, please, any reason as to why the spleen gets big,
So
the
yes,
enlargement of the spleen.
yes. So your the job of your spleen in a normal person is so it's your spleen is a gigantic lymph node. Your spleen is a lymph node, okay? So it filters your blood and get rid of all the abnormal hemoglobins out, any abnormal cells. So if you have like sideroblastic anemia, it's another hemoglobinopathy, another hemoglobin disease, which or hereditary spherocytosis. It's like your red blood cells are abnormal. What the spleen does is it filters it and take all the abnormal red blood cells out. Okay, it's sequestered. So the reason I guess that it get big is if you get a lot of sickling cell, it tries to get rid of all of it. So just stick in the spleen and then it keeps getting bigger. It keeps getting bigger. That's what happens.
Okay. Because you asked a very good question, a very primitive African question. Do the African concussions, herbs, really treat sickle cell?
I do not know, but I can tell you it does not cure it.
Okay. Robert Quay says, I'm SC and 40 years old. When I was in Ghana, I knew an old last who was 83. I don't know what I mean by old last. Who was
Old,
83?
old person, old people or whatever. Old lad, right? LED.
No, last. LAST. Yeah, you're on your own with that one. Who was 83 and was SS. She just took good care of herself. And my former landlord's sister was 78 when she passed on. She was SS. So I think it's just a contribution. Thank you very much, Robert
Can I
Quay.
say something?
Yeah, go
I,
ahead.
I just want to point it out that the fact that somebody is severe and getting a lot of crisis and somebody is not doesn't mean that they are not taking good care of themselves. There are some
Yes.
people whose disease is severe that no matter how well you take care of yourself, you're gonna get crisis. There are some people whose disease is mild that if you eat the unhealthiest things in life, you're still not gonna get crisis. It's all about the degree of severity of it. But if you
All right.
take good care of yourself, it can help.
Okay. This one is from Alliance. Says, PK, I would like to come on your show and share some knowledge I gain about SS through experience with my child. Okay. We're gonna post the link to the HITV platform. Producer, please put that link on for us. And also A-Class and Director Danny. I'm not sure if A-Class is here today, but A-Class and Director Danny, if you guys can put a link to the Friends of Tatapsen as well too, so that people can join and follow. Again, the HITV link we use to discuss future topics that we want to treat, and they will hear on the show, and also contribute towards the shows that we do treat. And the Friends of Tatapsen is for discussion any issues or concerns that you have with sending money home, or any contributions that you have with Tatapsen. AB says, Doc, so if one parent is carried, what's the chance of the children is going to be affected?
Okay, if you go to this page here, so over here, this patient here is not has two normal hemoglobins. One is a carrier. If you do have that, none of these kids have SS. So there's no chance that your kid is gonna be sickle cell diseased. But you have 50% chance that one of your kids is gonna be a carrier.
Hold on just a second. You might even project the screen so that people can see what he's talking about.
Do you want me to say it again?
No, no, not you. Producer was gonna project the screen because you were on the screen at the time. So yeah, repeat it again one more time so that people can see the
So
mapping.
in this screen here,
Hmm.
one patient, one of the parents has no disease, it's AA. The other one is a carrier, AS. If you look at their kids, none of the kids has the disease, but you get 50% chance of your child becoming a carrier. So if you have 50% chance of a carrier and 50% chance of having a normal hemoglobin.
All right. Fatty asks, can you take iron tablets long term?
Yes, you can.
Okay. All right, producer. Actually, drop the link to the chat room. So please click on it. And Arlene, please, you can reach out to producer or myself on the platform, and we will go ahead and work it out. Um, Rexford says, "Thank you, Doug. Good presentation." Why is my thing froze?
Thank you.
Okay, hold on just a second. Last comment I was idea Rexford. Okay, all right. So Rexford is the last comment I have. Huh? I do have a question from somebody. Since it came to my private message, I will not read the person's name. But it says, "Good evening, bro. Can you ask my question for me? What is the difference between middle sickle cell and what? It was just what is the difference between middle sickle cell? I don't know. Maybe what the difference between middle sickle cell and the real sickle cell.
So there's no such thing as middle sickle cell, but in the thalassemia, let me go back here. You know, I said the rare,
No, let me not mention name, right?
some of the rare variants. Can you see the screen? Okay.
Producer will put the screen up.
Okay.
Yes.
One of the rare variants, which is a thalassemia, right?
Mm-hmm.
Now, in the thalassemia, let's go back. It's alpha and beta. So we have alpha thalassemia and beta thalassemia. And if we go back to how what I talked about the red blood cells, the red blood cell has alpha has 4 subunits, beta has two subunits units. So if you have a beta thalassemia, right? We have beta not, which is beta minor, which is only one of the subunits of the beta is diseased. Then we have a beta major, which is two of the subunits is diseased. So I don't know if that's what he's talking about.
Okay. Well, I will let her reach out to you personally because I mean that's even your family, so I'll let her reach out to you personally. Um, yeah, producer, if you don't mind, because I think she lost your number, so she was asking for it. So after the show, we'll talk about it. All
All
right.
right.
So there's a question from Cristobal. And before that, let me go ahead and make say this because I was about to say that is when producer drew my attention to more private questions. But again, like Dr. Say rightfully said, he has his own specialty that he runs and has his own patients. All the questions that we have in terms of your specialty, everyone will be unique per their symptoms and their traits that they carry. Please make sure you consult your primary care doctor to get exact information that will be tailored to your circumstance because the circumstance per A varies to B and you cannot use the answer for B to yours because again like he said somebody can be eating very healthy and still be experiencing more issues and one can eat very unhealthy and may not even have any crisis at all. So all comes down or boils down to how everything is tailored to your specific need. Christobel says, I was told I'm sickling positive some days ago. Used to oh this message are running. Used to get pains in my legs and feet. Finds it difficult to breathe sometimes and fatigue. Please, I want to know if that's a crisis or something dangerous that can lead to death. The pains in my feet and legs happen sometimes and most of the times when I'm in my period. What can I do to help?
So that's a very so remember when I said acute chest syndrome, right?
Mm-hmm.
That's one of the life-threatening injuries, life-threatening complications. And one of the signs and symptoms is chest pain, cough, fever, trouble breathing, right? But then if you see that, chances are you gotta be careful with that. Now, leg pain and other stuff, that can be just pain crisis that needs to be addressed. But if you feel anything out of the ordinary, like breathing problems, I think it will be better to get it checked out to make sure that it's not like acute chest syndrome. Because that, if you don't get control of it quick, it can kill you.
Okay. And this question it's private, so I will not mention the name. I have a 3-year old with SS. She has had one crisis, and then her doctor started her on hydroxyurea.
Hydroxyurea.
Okay. Since then, she has had no crisis, and her fetal hemoglobin is high. Just want to know what to look out for in the future. Worried mom here.
So great. Hydroxyurea is a good, like I said, it was an accidental medication. The developers developed it to treat cancer, right? Now, it happened that it can help sickle cell patients because it increases your fetal hemoglobin. Now, the other side effects of hydroxyurea, we don't know that. So the long-term effects on sickle cell patients has not been long studied. But so far, we don't know any significant side effect other than it can decrease your bone marrow production. But
Okay.
your doctor should keep an eye on it. If they started you on it, chances are probably it's a severe sickle cell and benefits will outweigh the risk.
All right. Alice Asantua says, what are the possible risks and complications of pregnancy for women who have sickle cell disease? I think you already answered that earlier.
Mhm.
But if you can go ahead and brush it a little bit,
So
guys.
from what I know, mortality rate among Ghanaian pregnant women with sickle cell was about 20%. This is when I did a study, right? and um, and it ranges from lack of knowledge that they have that. Um, so clinical symptoms, they do not address it. They can become thrombogenic. If you are pregnant, you are high risk of blood clots. And then on top of you being a high risk of blood clots from sickle cell disease, that can be higher. You anemia aspect of it is high. And with that, no, pain crisis can also happen. So these are all symptoms from, if you get stress on your body, you can sickle easily. So once you are aware of that and you follow up with your hematologist, and if they see the sign of symptoms, they can transfuse you and get rid of your sickle red blood cells. Chances are you'll be fine. I've seen a lot of patients with sickle cell that have had babies and without any complication. The mortality risk increases if you do not address your signs and symptoms, or if you don't know what to do, or you don't follow up with your physician.
All right. So, Dr. Sir, I know your time is up, but then we'll just take a few more questions and wrap it up. So we're just going to be quick and snappy with the questions and the answers. AB says, Doc, in case 50% chance of the one of children affected, what medication is good for him or her?
It's affected, so you just look for signs and symptoms. The one medication that is known to be good for him or her is penicillin, especially if you're in Ghana, or areas that infection is up. You do penicillin from 6 months to 5 years. It will prevent
Okay.
infectious complications. Other
Not
than that, you get your vaccines to make sure that if your spleen is not, get vaccinations, and then eat healthy. Folic acid, depending on what your anemia level is, your physician will add some vitamins on it.
okay. Nani says take in folic acid, stay hydrated, don't do anything strenuous or stressful, cover
Yes,
yourself very well, eat healthy, eat more fruits, and take in iron supplement. Nani
perfect.
comes back to says, Doug, is it okay with you if you drop the presentation so we can learn about it? So if you send me a copy of the presentation, well, you're already on the HRA TV platform, right?
Yeah.
Um, okay, so
I'm not.
you're not? Okay, so um just send it to me and I will just drop it over there and so
Oh,
that
wait. The WhatsApp one?
yeah,
Yes, I am.
I know you're on it. That's why I
Yeah.
was I was confused when you said no. So just drop it over there and then
All right.
we'll take it from there. Prophetess Mary Esther says a few days ago my belly button started poking out with pain and heat. I have SC with many complications, monthly hospitalizations. Um, again, your hydro
Hydroxyurea.
hydro hydroxyurea side effect is infertility for some and hair loss. Oh, okay. So she's just throwing more lights on
Okay.
that medication. Doc, this is Auntie Linda Omani. You did great.
Oh,
Ebusia Lande. Again, producer has dropped in the chat room for the WhatsApp line. If you're not part of the family, just join so that we can discuss future topics that we want to treat right here on the show. Tab with Tatabs in. Again, I'm expecting that link from Director Danny. If A class is not your Director Danny, can you please drop that as well? I don't get to see the participant side because of the questions. Akoso says, Doc, are there any clinics specific for sickle cell in Ghana?
yes. I know there is a sickle cell clinic in Kolebu. That's when I came to um um Ghana to do my research. There was a sickle cell clinic in Kolebu that they opened every Wednesdays. But other than that, I don't know.
Okay. Um, I hope I did not miss anyone's message. The last one from Prophetess that we're gonna take before we leave is wanted to him to give me suggestions on what to do, please, about the hernia or the protruding belly button.
I mean, protruding belly button is a hernia, right? So the question is, if it is painful, you just have to. Now we're segueing from sickle cell to surgery, right? Which I'm a surgeon. So usually you gotta figure out what the hernia is. Is it fat containing? Does it have bowel in it? I think they can do an ultrasound, a CAT scan, take a look at it, and then if it is not incarcerated, which is stuck in there, and it's not causing you too much pain, technically you don't have to fix it. But if it is aesthetically, you can go ahead and fix it. Any surgeon can take care of it for you.
All right. Thank you very much. Director Danny, thank you very much for the link. The link is there. Please click on the link and also be part of the Friends of Tatapsen as well. Prophetess Mary Esther says, okay, thanks. And thank you, Doc. More grease to your elbows. And this is from Fadi. And also iPhone says, you did great, Doc. Very knowledgeable. We are proud of you. I'm pretty sure that is the Orion. The way. All right. Thank you very much for coming and also taking time out of your busy schedule. God bless you for your time. For the first time, I've had my best friend on the show, and we hope he comes back again. Ebusion for moment the pressure on Braba because I know it's hard to pull him out of his busy schedule, but. Producer probably had a question for you, but I don't know. Say maybe now on this topic, on another topic. Okay. Maybe he wants to know: are you Kobe or Michael? Are you Kobe or LeBron fan?
Definitely Kobe.
All right. On that note, director, can you please sign him out for us? Director, can you please sign him out?
So all right. Thank you, everyone. Thank you for coming.
Oh, the director will sign you out real quick.
Okay.
Dr. Sami, I think it was a great information transfer to me. So our topic, me interested by any time we do it. I think last year we did it.
I think it was last year.
Doctor, I can't thank you that much. I mean, baby, like we can't pay you information now with the mind. We thank you very much. I hope Senka Ubesabe.
Pleasure,
yeah, no, okay. Right.
Oh, I mean, PKWASENSO, so we'll talk about it.
Yeah. All right. Thank you very much, Director, for the great sign out. On this note, Dr. Say, thank you very much for your time. Have a great night. And also, everyone that joined, I want to say thank you so much for joining. Big shout outs to all that joined from far and near, especially those that have awkward hours right now. I mean, it's late or super early morning wherever you at, but you took time out of your busy schedule and you made a special date with us to have this great conversation. On behalf of the team, my producers and myself, I want to say thank you so much for coming and also supporting this program. And please spread the word so that we can educate ourselves and our families worldwide and not just keeping the message to ourselves. The world is a global village, so let's take great opportunity of that. And also thanks to everyone who also shared this Zoom link and the Facebook link as well, just so that others can also be a part of it. I'm so grateful. And like I said, we cannot thank you guys enough. Your support will never be taken for granted. Director, thank you very much for your time. And also producer and Lord, always on the ones and twos, making sure that we bring you guys nothing but the best. On this note, we're going to sign out from Facebook and YouTube. And we're going to hand over to Uncle Jimmy for the Q&A session for Tatapsen. And he will run a smooth session. Make sure that you have all the good things and all the answers that you're looking for. And also, if you do have some contributions that you want to add to it, please do so. Thank you very much. And my name is PK OFORI-ASENSO. God bless you. See you guys same time next week.
PK, thank you for having me too. I appreciate it.
Thank you, Dr. Say.
Yeah, boss.
Bye.